But what I would like to start within the pharma trends, you have covered a lot, obviously in terms of the cost, and in terms of the AI, in terms of the therapeutics, the ADCs, the RLTs, and the focus on that. But there are some other elements that the pharma industry and the trends that they are going through, and especially here in the US. Yes, okay, there's an increase in cost in already an industry which is very, very heavy in terms of financial investment. The costs are going even higher now with the inflation and it's the new tax regimens. And we see that all the time, and we hear it from all the big all the pharma in terms of the cost. There's that. The second element that is really important, and especially in the US, is this IRA, the Inflation Reduction Act, which is causing a lot of grief to the pharma industry. And initially, the idea was that, okay, there was this list of 10 drugs, and then all the pharma companies even challenged the government on that. And now, last week, we heard that it's not going to be 10, it's not going to be 30, it's going to be 50 drugs being part of this IRA list. So it's really putting a lot of pressure and a lot of uncertainty within this the industry, and a feeling from the government that the government is pulling away from the healthcare and pharma, and especially, and pulling away from innovation. And here we are in an industry whereby innovation is key. If you don't invest, if you are not the first to market, you're not going to be getting back your investment. So basically, there is now, because they are so reliant on innovation, and that it costs a lot of money to develop and a lot of time, we all know that, is that the easy solution, well, easy in brackets, is very much the M&A. And they are looking at more late stage assets. Before it was more like, okay, early scouting, early identification of new assets so that they can help it develop. Now, there is kind of this sense of urgency whereby, okay, we need innovation, we need it now, so we're going to look at those late stage assets and bring them on board. So now, obviously, going digital for a pharma company is not an option anymore. It is a requirement. So there are different approaches that a pharma can do. As Kauta was mentioning, you can do that fully internally. But what we are more and more seeing is the integration of the pharma and the tech industry together, each bringing their expertise to the table to enhance this this industry, and with the ultimate goal of bringing drugs, safer drugs to the market and quicker. So so far, the companies that were very advanced in AI and implementing it, like the Novartis and all the big ones, they were really introducing them within, introducing the technology within the manufacturing processes, making sure that AI was supporting, the processes, especially. Now, the technology and AI tech is facilitated earlier in the more and more earlier in the R&D process. So it's going to be really from early drug discovery target identification to facilitate personalized medicines, and understanding the disease progression, the target activity, and especially one of the big focus where that is being implemented at the moment is within the clinical trials. How can you make those clinical trials that take years to take place and is a necessary step and is, I mean, it represents 60% of the R&D cost. So how can you make it better? How can you be better at patient segmentation? How can you be better at making sure that you've got results quicker? So